please just continue to finish your salad, and I think they'll be serving lunch also. I don't mind a little noise. It doesn't bother me a bit. Remember, I was a school teacher and I have 9 grandchildren, and nobody pays attention to me when I talk, so that's okay. That's okay. But I did notice that the snow stopped, which is really wonderful. I think it's become a tradition, however, in case any of you weren't here last year. We had snow last year too on the same event, so I think it's becoming a tradition. The weather likes to celebrate with us. Welcome and good afternoon to everyone to the 2019 Champions in Women's Health Awards ceremony. It is such a privilege and an honor to celebrate these impressive women today. And we are also so thrilled to see so many of their friends and family. It's hard for me to believe, quite frankly, but this will be our 16th year of this very special tradition, through which we have recognized and awarded over 100 wonderful champions. And I'd also like to say thank you to our dedicated Champions Selection Committee for volunteering your time and helping us choose again such impressive 2019 awardees. Thank you also to our Wisconsin Women's Health Foundation board member, Dr. Molly Carnes, for being here today. A lot of the credit for the success of the foundation, she was there in the beginning, and it goes to you, Molly. Thank you so much. Also, a very, very special thanks to our generous sponsors, Marshfield Clinic Health System, UW Department of Radiology, WPS Health Solutions, Centene Charitable Foundation, BR Diamond Suite, and Leonard and Joyce Shraeger. We are so incredibly fortunate and thankful to receive your continued support. And finally, I'd like to thank you, to give a big thank you and shout out to our 2019 champions, their nominators, and friends and family who have come to celebrate their accomplishments with us today. Please go ahead and eat. You're all looking at me now, and making me really nervous. Our mission at the Wisconsin Women's Health Foundation is to innovate, impact, and improve women's health. The Champions Awards are a unique opportunity to seek out nominees who represent our mission and have demonstrated dedication to women's health through outstanding achievement in their specific fields. Just as past award winners have devoted themselves to improving the lives of Wisconsin women and families, this year is no exception. Our 5 chosen awardees are all accomplished health leaders and extraordinary women and examples of what it means to be a woman's health champion. At the foundation, we connect women and families to health resources and provide programs, education in all 72 counties of Wisconsin, serving more than 7,500 women annually. Our work would, however, not be possible without partnering with talented health leaders in our state, like the very individuals we are honoring here today. I am always amazed by the impressive work being done by all of our nominees. The level of excellence of these nominations made the job of selecting just 5 champions very, very difficult. But we are continually grateful. We have this problem as it reflects a great dedication to improving women's health throughout Wisconsin. Each year, it is our goal to highlight individuals who have made a difference in women's health and their organization, the community, or the state. They have been trailblazers and role models for others to follow. They help achieve our vision of a healthier Wisconsin. A woman's well-being encompasses, as you know, so many areas of health, which we are proud to have represented here today. This year, our recipients span from many regions of our great state as well. They hail from the Wisconsin communities of Weston, La Crosse, Madison, and Milwaukee. Before we meet the champions, I'm going to turn it over to my daughter and executive director of the foundation, Tommy, to share more insight. Here, 1 minute, Tommy, don't get too excited. To share more insight about the foundation and introduce the champions. Now, Tommy, you're on. Thank you.
Thanks, Mom. I'm also honored to be here today to recognize such impactful health leaders in our state. I really find this event to be one that I love and one that probably my favorite event of the year, so I'm excited to be here. The 2019 Champions in Women's Health Awardees are definitely an impressive group. But before we honor our champions today, I'd like to just take a brief opportunity to tell you a little bit about the work of the Wisconsin Women's Health Foundation. As my mom mentioned, the mission of the foundation is to innovate, impact, and improve women's health. Our staff is dedicated to providing the highest caliber evidence-based programming and services to women and families in all 72 counties. Our First Breath program will support a woman in her quit smoking journey, ultimately resulting in healthier babies. In our My Baby and Me program, we provide consistent messaging and information about the often confusing issue of alcohol use during pregnancy. We help women achieve alcohol-free pregnancies through screening, education, phone counseling, and text message support, serving over 20,000 pregnant women each year. Our Grapevine program works with women across the lifespan to learn how to make lifestyle changes to prevent and address women's health issues. We are also in that program reaching over 2,000 women annually, with topics including breast and gynecologic cancer, cardiovascular disease, mental health, self-care, brain health, bone health, diabetes, and many other areas. We are also administering the Susan G. Komen Breast Fund, which gives us the opportunity to assist individuals with mammography and screening, and if someone is found to have breast cancer, we can help them with financial support for access to treatment, including transportation, child care, rent, and many other items. And our latest addition is the Well Badger Resource Center. Well Badger provides women and families with health information and referral to services. We receive calls from women all over the state who are looking for resources, such as children with special needs and developmental disabilities and delays, women, infant, and children nutritional resources, Badger care assistance, screenings available through the Well Woman program, and access to birth to 3 programming, to just name a few. In a nutshell, we are trying to meet the needs of women and families across the state, both locally and statewide, and we're really trying to meet women where they are at. In order to celebrate all this work and to raise funds to do it, we put on a big party at the Capitol. So should today leave you wanting to continue to support and celebrate women's health, we invite you to come back here. Well, not exactly here, but actually right there at the Capitol. On Saturday, May 18th, we'll be holding our 22nd annual Spring Gala in the beautiful Capitol Rotunda, and we'd love to have you join us. In fact, each of our champions in women's health has been gifted with 2 tickets to the event, so come celebrate with them. There'll be wonderful food, live music, and dancing between the 4 arches in the Rotunda. It truly is one of the most unique events in Madison. And best of all proceeds from the event go to our programs to support Wisconsin women and their families with the resources they need to achieve their healthiest potential. But enough about that celebration. Let's get back to today's event and the reason we are all here. It's time to meet our champions. After I announce your name and give a brief introduction, I invite you to come up and receive an award from my mom and say a few words. So let's begin. Our first champion today is Amanda Boreen. As a registered nurse, Amanda has years of experience as a certified breast care coordinator at Marshfield Clinic. In this position, Amanda helps newly diagnosed breast cancer patients navigate their way through treatment. She guides them through a large interdisciplinary caregiving team, including oncologists, surgeons, mammographers, radiation oncologists, pathologists, plastic surgeons, nurses, physical therapists, and support staff. She assesses the needs of patients and their families and refers them to appropriate resources such as transportation, financial assistance, and emotional support. Amanda acts as a helping hand through the entire course of treatment and survivorships. She keeps the lines of communication open with providers and patients and builds a rapport with all. In the words of her nominator, Dr. Untitled, she can help deliver a bad prognosis to a patient with finesse and seamlessly transition into the next step that patient must follow in their treatment. She does it while making the patient comfortable and making sure they completely understand what is taking place. It's a skill that comes from years of practice that is difficult to master, and she does it with her genuine dedication and sincerity. I know these are standout traits of Amanda's, as I've been told by more patients than I can count how much they appreciate her gentle guidance. Facilitating the connection between patient and provider is critical in the treatment process, and Amanda is a master at making that happen, says Dr. Untitled. Amanda's joy is brought to her not only through her work as a breast care coordinator, but in her role as mom to her son Uriah. When we asked her what her perfect day was, she said, "We'd need to whisk her away to the Cayman Islands to go snorkeling." Unfortunately, we won't be able to do that today. But we hope you'll accept our offer for a dance on a hopefully warm spring night in the capital in May. Will you please help me in honoring Amanda Boreen as one of our 2019.
Thank you. It's an honor to be here today, of course, and to receive this award. We're really doing some great things in Wisconsin for women's wellness, as we can see by the present and past recipients of this award. So I'm really proud and thankful to be here today. I'm often asked what I do, or what does my role involve, and that was a very nice flow to things. But I often find myself explaining why I do what I do, and as Dr. Untitled said it very well, it's because I can make a difference, and it's because I can do something impactful. So whether that's navigating that newly diagnosed patient and family throughout their treatment plan and past that, or answering a difficult question in the community, I feel that we can make a difference. So as being an award recipient, we're role models for the future, and I hope others can see that in myself as well. I would like to thank our amazing leader, Dr. Untitled, for my nomination, of course, and the rest of my care team, some of which are with me today. I can't do it alone, so we do need a team. I'm also very thankful for my family and that they're here today. Without their support throughout my nursing career, it would have been hard to accomplish everything I have. And for Mom Rhonda for guiding me into nursing, which I do truly love. Nice pictures there of me and what I like to do in my free time. So a lot of family time, and I'm thankful for my husband Michael and son Uriah that understand the compassion and dedication that I have to what I do and to our communities, and that sometimes involves extra time after work or on the weekend, but it is important to me. It is important to them as well. So I thank you very much for the award today. I'm proud and blessed to be here. Thank you.
Thank you, Amanda. Our next awardee this afternoon is Dr. Keely Reese. Keely is a professor in the Department of Health Education and Health Promotion at the University of Wisconsin-La Crosse. She serves as the director of the Undergraduate Public Health Community Health Education Program, as well as the academic director of the Masters of Science in Healthcare Administration for the collaborative degree with the UW Extension, Continuing Education, Outreach and E-Learning. She has been with the department since 2003 when she moved to La Crosse. 16 years later, it is still home. Her research spans maternal and child health to the full extent, with a focus on prenatal care, exercise, prescription, and behaviors during and after pregnancy, social support for preconception and prenatal nutrition, tobacco use during pregnancy, and sexuality education. Additionally, she has conducted research projects working with pregnant women, young girls and body image, preconception prenatal nutrition, contemplative practices, organizational support of working and lactating women, international health of women and children to include cervical cancer, contraception, and nutritional needs, LGBTQ health behaviors, and perceptions of campus climate. As a professor, Keeley creates the type of supportive, open, and realistic atmosphere many young women are looking for as they strive to find their own interest and voice. As one of her students said, her passion, commitment, and desire to improve the lives of women and families in our state is clear through everything that she does for those who are fortunate enough to learn from her. In her spare time, she co-facilitates a community and faith-based program called Our Whole Lives, serves as an advocate and mentor in the community, and also works with the Pine Ridge Indian Reservation and global partners of Gunderson Health System to provide education and advocacy with Native American youth and leaders. While doing all of those things, Keeley also has a family. No matter the season, you'll find Keeley, her husband Kurt, her son Gavin, and daughter Harper enjoying the Wisconsin weather. Whether skiing the slopes or hiking the bluffs, the Reese clan always finds a way to enjoy the day. When we asked Keeley her life's motto, she said, "Be kind, for you never know what the other person is going through." I completely agree. Please join me in commending Dr. Reese for her accomplishments in women's health.
Kind of wish we were surfing today, instead of looking at the snow. But, well, first of all, thank you. And it's an absolute honor to be here with such an accomplished group of women. And to be surrounded at a table of women that I've had the honor to mentor and still remain friends. I think it's just great when you have students too that you end up following and becoming friends with and watching them grow their families and their lives and then continue on in this work. And as I was talking to a couple folks before we started, the number of students that have landed themselves in this amazing organization and have touched it in some way or shape or form has been really exciting. My work as a health educator, I feel like a lot of what I do in health education and public health is advocate for what we do in public health and health education. And so 90% is just helping the next generation of workforce find their passion in this field and then find their way to advocating for the things that they care about. And my work in maternal and child health has allowed me to really bring in, I mean, as she mentioned, most of my work is in collaboration with other women, with other men, other organizations, partnerships, coalitions, and the research that we've been able to do allows me to pull in a lot of undergraduate and graduate students and my colleagues as well. And so 90% of what we do is advocate and tell others what we do in the profession and then help establish a really strong workforce. And one of the things I'm really proud of is the workforce in Wisconsin for public health and health education is very strong. The number of our students that come out of our La Crosse program that stay in La Crosse is very strong, very high. They may leave for a while, go to other countries, other states, but many of them come back and do this really hard work in our state, and it's been really exciting. The last 5 years of my work has really shifted to advocacy and public policy, and so we bring large groups of students to Madison. We're usually in this hotel or one over, and we're really working on how to train them to do the policy work, the advocacy work that really changes the lives in our state, and it's been an absolute joy. So I feel like when I'm standing in this area, I feel like I'm at home, standing next to the Capitol, which embodies so much of the work that we do. Like our other, I know, speakers that will be talking, none of us could do this alone. I stand here only because of incredible mentors, incredible colleagues that have mentored me through my schooling, all the way from when I was young, all the way through my University of Minnesota, University of New Mexico, my mentors that I'm very connected and close with, women before me that have paved this path. When I was asked about who I think are some, strong women, I think about Ruth Bader Ginsburg, I think about Brene Brown standing up, who, have been doing the work and being brave and being vulnerable and sort of face down in the arena, because it's not easy work. So I do this with my family, my mom, she's here from South Dakota, and my daughter, Harper, and my husband, Kurt. My son is in Eau Claire playing in the jazz band, so he's got to do his duties today. But I'm really grateful, I'm very honored, and I'm incredibly inspired by the other women and all of you at the foundation that do this work and started this foundation and continue to carry this on. Very grateful. There we are. We'll pretend it's summer. Thank you again.
Thank you, Julie. Our third champion this afternoon is Dr. Serena Shraeger. Serena is a professor with the University of Wisconsin School of Medicine and Public Health, Department of Family Medicine and Community Health. Her practice encompasses full-spectrum family medicine with a focus on maternal and child health. This began following her residency training in family medicine when she took a fellowship in women's health so that she could focus her medical practice on women. In addition to conducting a full clinical practice, Dr. Shraeger is the director of the academic fellowship at the UW. She has consistently taught students and residents how to care for women and has gone the extra mile to do research and advance education in women's health. Dr. Shraeger has published over 70 papers on many important women's health topics, including patient-doctor shared decision-making in breast cancer, screening, breast pain, and menstrual migraines. Dr. Shraeger's scholarly work helps to inform the broader medical community about health issues relevant to women. In reference to the community, the foundation has also had the pleasure of working with Dr. Shraeger in the community at an earlier phase in her life. I'm going to take us back to the year 2000. The foundation was just getting its roots set, and we were facilitating a program called the Roundtable Discussions. Women from throughout the community gathered for a meal to listen to healthcare professionals, share important information on women's health topics, and connect with local and statewide resources. Dr. Shraeger volunteered her time with us, dedicated to reaching women in places like Wood County at the Sherry Town Hall, where she educated about cardiovascular disease, and she went on to do many more with us over the years, so thank you for that. Dr. Shraeger is now entering a new phase in her life. After committing the last 15 years to her role as a soccer and hockey mom, she's retiring trips to tournaments and early morning practices at the rink, and is now able to spend more time reading, knitting, cooking, and traveling. As a hockey and soccer mom myself, I am happy to hear that there's life on the other side. We are so happy to be recognizing Dr. Shraeger this afternoon for all of her work. Please help me welcome her to the podium.
Thank you, Tommy and Sue Ann and this wonderful organization. And thank you to Molly Carnes, too, who nominated me for this award. I met Molly when I first came to the University of Wisconsin in 1996. And I think, Molly, you were probably the one who got me involved with the foundation at that time. I went into family medicine because I firmly believe that women's health is integrally related to the health of their families and the people around them. For the last 22 years, I've been privileged to be part of hundreds of women's families and lives on the north side of Madison through my clinic, UW Health Northeast Family Medical Center. I've been able to be part of their joys, having children, getting married, falling in love, going on great vacations, sometimes even having a great pair of shoes is something that we celebrate, and that's a wonderful thing. But I've also been honored to be parts of their lives for things that were not so joyful. Personal illness, death in families, children having issues with the law, with health, addiction, violence, homelessness. I mean, the list goes on. But I feel really privileged and honored to think that maybe I had a little bit of an impact in all of those women's lives. I would like to thank my family, my husband Ken and our 2 sons, who, as they enter a new phase of life, I hope we have done a good job raising them to be caring young men who are citizens of the world as they go out and explore new adventures. I'm hoping that they will honor themselves and women that they meet throughout their lives. I'd also like to thank my extended family, many of whom are here today, and close friends who have been part of our lives and helped us get through some of the hard times and just the crazy day-to-day life of a house with 2 doctors and teenage boys. It involved a lot of food and great support and people stepping in at the last minute to drive so-and-so here and always coming to cheer them on at their hockey and soccer games, which I have to say I'm a little conflicted. I'm happy that that phase of my life is done, but I am sort of sad to see it go. So anyway, I am excited about the next phase of my life and our lives as, quote, empty nesters. So we'll go on from there. Thank you to the Wisconsin Women's Health Foundation. I've always admired the foundation and their steadfast advocacy for the health of women in Wisconsin. So 22 years down and keep going for another 22. Thank you.
Thank you, Serena. And if you're really missing it, after this I have to go to a soccer tournament in Boston, and it is on still, and the Chases are joining me, so if anyone else would like to go watch soccer in the snow, join our caravan. Next I would like to recognize, okay, and I need my, I'm sorry, I need my glasses. Next, I would like to recognize Dr. Julie Schuler, the president and CEO at 16th Street Community Health Centers in Milwaukee. Dr. Schuler was first called 16th Street home as an internal medicine physician over 25 years ago. At her core, she has a strong belief in fundamental human dignity, which has been embedded in the care she has provided to each individual patient since day one. The passion and devotion remained unwavering and even grew stronger as she assumed the role of medical director, then executive vice president, and now president and CEO at 16th Street. Under her leadership, 16th Street is recognized as having successful women's health programs and clinical outcomes unparalleled among most community health centers and traditional medical settings nationally, while serving a mainly low-income population with a variety of social, economic, and clinical barriers to being healthy. This comes after years of leadership in developing protocols and programs of clinical excellence, and Dr. Schuler's belief that their patients should not get anything less than the highest quality care simply because they are poor or come from another country or speak another language. An active leader of numerous organizations, including the board of directors of the Wisconsin Collaborative on Healthcare Quality and the Wisconsin Medical Society, Dr. Schuler has long believed that we need to reach beyond the clinic walls to address the social determinants that impact our health. Poverty, lack of nutrition, homelessness, unemployment, social supports, stress, and public safety. Her commitment to improving the conditions where people live, work, learn, and play is the driving force behind an ever-growing list of community partnerships and collaborations she has spearheaded to create healthier individuals and healthier population. In the words of her nominator, simply put, our community of women would not be the same without Dr. Julie Schuler. Her positive impact on the health and well-being of women in our community is evident throughout her career and will continue long into the future due to her vision, organizational leadership, strategic direction, involvement in numerous professional and community organizations, and undeniable dedication to 16th Street's patients and community. When we asked Julie what her dream destination was, she said she wanted to travel to all 50 states by the time she turned 40, or by the time she turned 50. She made it to 49. She still needs to go to Hawaii. I think with weather like this, we should all join her. Let's please put our hands together and recognize Dr. Julie Schuler.
Well, hi everybody, good afternoon. Thank you to the Thompsons and to the Wisconsin Women's Health Foundation. This is really a great honor, and I am also honored to join the other wonderful women and to hear about all of your accomplishments. I'm humbled to be a part of the group, so thank you. There's two things I wanted to mention as I thought about comments. One is this award, I have the privilege of leading 16th Street. 16th Street is a community health center like Access Community Health Center. There's folks in the room from Access. A community health center is really a being in and of itself. It's an organic body that lives on for the community, and it really is my privilege to lead 16th Street. 16th Street is celebrating our 50th anniversary, of which I've been there about 25 years, as you mentioned. And in the 50 years we've been around, we've been collecting some interesting statistics for our 50th anniversary, and they kind of have blown me away. We've cared for over 500,000, 500,000 people in those 50 years. A city, of course, about half of those are women, and so that's a lot of pap smears and breast exams and mammograms and all that sort of stuff, depression screenings, etc. We've also delivered in that time period over 20,000 babies, and that number too staggers me that we've been able to accomplish so much. We do pride ourselves in the quality of care that we provide to women and their families because, like Tommy said, I believe everybody deserves quality health care no matter who you are, where you come from, or what language you speak. And I'm really proud to be able to do that for our community in the south side of Milwaukee. Secondly, I just want to say that I am so blessed to work with a team full of mostly women whom I've worked with for almost 25 years. Sue Raymond, Rosa Maria Martinez, Dr. Maria Perez. I couldn't have done it without you. You guys have been my support. And I'm so blessed to work with you. And for that length of time, you can imagine working together for that long, we've become pretty close. And we've weathered a lot of storms, and I'm sure there'll be more to weather in the future. But couldn't think of doing my job without you guys, so thank you for doing the work with me. And that's it. I'm very humbled, and this isn't my work. This is God's work. This is 16th Street's work. This is these women's work, and just privileged to be able to pitch in and help out. So thank you, everybody.
Not a well-oiled machine getting up and down off this lift stage, sorry. Our fifth and final champion today is Beth Summerville. Beth's nomination came to us during a turning point in her profession, her retirement. A nurse whose career has spanned from med-surg units to ICUs, From research coordinator of the SAVE study, look at ACE inhibitors for heart attack patients, and then urgent care to unit manager, Beth has done it all. But the pinnacle of her career began in 2003. Beth dedicated the next 15 years of her life to the UW Health Breast Center. She left a mark, and really, she left a legacy. Beth revolutionized breast health services. In 2003, a patient's breast cancer diagnosis was often filled with frustration, fear, and met with gaps in care. But Beth's natural compassion and skills changed all that. One of the first nurses in the nation certified as an RN breast navigator through the National Consortium of Breast Centers. And mind you, using her vacation time and her own expense to train for and subsequently take the certifying exams. As a nurse navigator, Beth provided a variety of services for her patients, explaining the need for breast biopsies, educating women about newly diagnosed breast cancer, arranging multiple appointments, providing treatment information, and facilitating insurance coverage. Her greatest skill, however, is providing emotional support. She is a great listener and was always a phone call away, even if her patients just needed to hear a reassuring voice. I can say firsthand, I was a beneficiary of Beth's work, and so was my colleague, Emily Sullivan. We were kind of the bookends of Beth's breast navigation career. My diagnosis in 2004 and Emily in 2016. We can both attest to her amazing dedication to her patients. With Beth, her great listening skills often gave her insight into special situations. For example, a patient might not have an adequate support system, so Beth would attend a doctor's appointment with her. Realizing a patient had been a victim of domestic abuse, which could escalate with a health crisis, she discreetly provided contact to domestic abuse prevention services. After a patient had recently finished chemotherapy and shared with Beth her excitement about having her eyelashes grow back, Beth gave her a tube of mascara to show off those lashes. Even into retirement, Beth's will to help doesn't waver. These days, you will find her volunteering with a Parkinson's disease exercise group and a local charity to help school-aged children access food when not in school. I love Beth's motto, "Let it be," which she has been known to sing in the car. So who doesn't love the Beatles? Perhaps if we clap loud enough, we can get a quick rendition for Beth. Will you please put your hands together for Beth?
Wow, no wonder I'm tired. Thank you for the very kind words. And thank you to Sue Ann for calling me on my birthday to let me know that I had been chosen as a champion of women's health. It's a gift I'm never going to forget. Wow. And thank you to the staff at the Wisconsin Women's Health Foundation and the Champions Committee for the work that you do in the state of Wisconsin and for choosing me to be part of this Champions group. It is truly an honor. I'd like to congratulate my co-champions as well. I was able to talk with a few of you when we were getting our pictures taken. It is a pleasure to be a part of this group. I am beyond grateful to Kathy Baus for even considering that I would be worthy of such an honor and nominating me. And then to Pam Propek and Lana Beyer, I'll stop it, Lana, to Lana Beyer for thinking that it was a good idea and helping put all of the nomination together. All of you ladies mean the world to me, and I cannot imagine doing a day's work without you, even though I don't have to do that anymore. Much of my success is because of a fantastic, as everyone's been saying, a fantastic team, a group of professionals who made my job easier. To me, that group, my rock stars at the UW Health Breast Center at 1 South Park Street, are a group of professionals who are truly dedicated to one thing, patient care. They are focused on the people who walk through the door every single day wanting to make a difference in their experience at the clinic. You've got physicians, technologists, nurses, social workers, tech assistants, receptionists. They all make a difference to every single patient, and they work together very well. As you mentioned, during my tenure in breast care, I have seen the delivery of care change dramatically. When I first got into breast care, it was disorganized, it was inefficient, there was frustration among the physicians, among the staff, and certainly dissatisfied patients. Now, we have a more coordinated, timely, interdisciplinary care model that focuses on efficiencies, timely care, so people don't have to wait as long for biopsies, pathology results, and so forth. And it's resulted in better patient outcomes, both mortality and morbidity, and more satisfied patients and happier providers. Part of what happened during that transition, as was mentioned, the role of the patient navigator. And I sat for my certification at the first year that they were offered, and that was in 2010. This year, my colleague and dear friend, Lana Beyer, took her examinations and last month became newly certified as a breast patient navigator. I'd like to publicly congratulate her. I am honored to be chosen as a champion of women's health. All of this has exceeded my wildest dreams. I couldn't have ever imagined this. Thank you to the Wisconsin Women's Health Foundation for today's event and the snow stopping, and to all of you who came to join your champions today. Thank you very much.
Well, let's give our 2019 champions one more round of applause. Today's award ceremony highlights the importance of dedication to community and is a testament to the unique role each of us plays in the health and well-being of women in this room, this city, and this state. We are grateful to be able to practice this tradition of recognizing health leaders in our state, and we hope to continue it for many years to come. Well, now it's time to continue the celebration with dessert, and they will be setting that up, I think, shortly. We may be a little ahead of the schedule, I think. So that will be coming. Emily, and I know, Emily, if you want to stand up, she is our photographer for the day. So if anyone would like pictures with their family members or anyone, please just find Emily, and she's happy to do that. Also, the plants that are on every table, please designate someone at your table to take those home. And I think that is all there is. So I really appreciate everyone coming today. We will see you at the Capitol hopefully on May 18th. And just thank you to the 2019 champions. You guys are an amazing group, and I look forward to partnering with you on many projects in the future. So thank you.